everyone, and welcome to Healthwatch. I'm your host, Carolyn Wilson from Ledgelight Health District. The goal of this program is to bring you information on a wide range of interesting and important health topics, and to introduce you to the people doing great work across the community. Today, I'm joined by Jen Croce, Vernalisa Walton-Bogel, and Lauren Whitmore from Mobile Crisis Intervention Services. Welcome to the show.
Thank you.
Thank you.
So to get things started, I want to thank you so much for joining me today. I'd like to get to know each one of you a little bit more. Starting with you, Jen, tell me a little bit about your position and how long you've been doing it and your current role.
My name's Jennifer Croce. I'm a licensed clinical social worker and one of the supervisors of the Mobile Crisis Intervention Program at UCFS. I'm one of the supervisors in the Southeast region alongside Vernalisa. I've been working with the program for almost 9 years now. I started as a clinical intern when I was in graduate school, and then I've moved up to the program. So I've been a supervisor for about 3 years.
Hi, so I'm Vernalisa Walton-Bogel. I am a licensed clinical social worker. I have been with UCFS since 2016, where I started as a clinician in our intensive family preservation program before transitioning to Mobile Crisis as a per diem clinician. And eventually I became a member of the supervisory team in the Southeast with Jen. I also work with adults in our outpatient program at the Norwich Health Center.
Terrific. And last but not least, Lauren, tell us a little bit about you.
Hi, Carolyn. My name is Lauren Whitmore. I am a licensed clinical social worker, and I've been with Mobile Crisis at UCFS since 2017. I began with the program as a clinician, and I recently became a supervisor in our Northeast region, overseeing our Plainfield office.
Wow, terrific. You are a very experienced bunch. I'm very much looking forward to our talk today. Our first question is to tell everybody a little bit about what Mobile Crisis is. Jen, can you help us learn a little bit more about that?
Absolutely. So Mobile Crisis Intervention Services is a statewide program that serves youth in any sort of behavioral health crisis. So clinicians are mobile and can respond to schools, homes, or other community settings to assist with a child and family in crisis. In different areas of the state, different community agencies hold the contract for their local mobile crisis team. And so in the Eastern region, which means all of New London County, all of Windham County, and 3 towns in Tolland County, United Community and Family Services, or UCFS, holds the contract. So we're available 24/7 and 365 days a year. Whether in person or via telehealth or just telephonic responses, we can respond to crises at any time on any day. We are mobile from 6 a.m. till 10 p.m. Monday through Friday, and 1 p.m. till 10 p.m. weekends and holidays. In the after hours, all crisis calls are handled by licensed clinicians, and someone is always available to answer that phone and help someone in crisis. It's important to note that we recently went through a name change. So if Mobile Crisis doesn't sound super familiar to you, here's why. Historically, we were referred to as Emergency Mobile Psychiatric Services, or EMPS. And so statewide, we felt that that name really didn't represent what we do. It implies that we help with medications or we prescribe, and that's not a service that we can offer. So anecdotally, people would refer to us as EMPS or EMPS or 211. And so we changed it to represent the service we provide. And so we are Mobile Crisis Intervention. It's the same service as before, just a different name. So when we're fully staffed, our team is made up of 18 clinicians, 2 case managers, and a project assistant. All of our clinicians hold clinical or master's level licenses in a variety of disciplines. We have social workers, we have marriage and family therapists, we have mental health counselors, really a variety of different outlooks on what could be going on with a kiddo in crisis. The management team, as you noticed for the 3 of us, is made up of 3 supervisors. We also have a program manager and a director. And every member of the supervisory team has worked as a clinician, has been in the field and on the front lines, really helping these kiddos.
Wow, that's so important. And thank you for framing that for this discussion, because I know when I first contacted you, when I wanted us to talk about this today, I was calling it EMPS, like, and you know, I was still using that older name, and I'm so glad that you could explain that to us and tell us so much about the important work that you do. Next up is Lauren. Tell us a little bit about who can receive services and who can call.
Sure. So we work with children ages 0 to 17, 18 if they are still enrolled in high school and at the school at the time of the call. Of course, during COVID, we have a few things that we're doing differently. So we are responding to calls for 18-year-olds that are enrolled in high school, even if they are not at the school at the time of the call right now. So anyone can call us. That includes the clients themselves, parents, the school, day camp counselors, outpatient providers, whoever is with a child who they feel or identifies as being in crisis. We do require parent or guardian consent for the assessment and permission from a homeowner or renter if the client is located at like a friend or a family member's home at the time of the call. We will respond and conduct an assessment in a school setting, with the school being like acting guardian if a parent or legal guardian are unable to be reached at the time of the call. But the assessment would be stopped immediately if a guardian is reached and declines our services. We always require schools to make their best efforts to reach a parent or guardian as soon as possible when they know they're going to call us or as soon as they have finished reaching us. That being said, a child can call for phone support without parental knowledge, but if a mobile response is requested, we will need to speak with a parent or guardian prior to responding in person. We do require that an adult is present at the time of the assessment. But if a child does call without providing the parent info, we do make our best effort to gather that information if possible in the event a safety concern does come up during the call. Additionally, it's also an important thing to add that if we do receive a call from someone who requires interpreter services, we do have access to a program called Language Line, which we can use either in person or via phone.
That's fabulous information. Thank you so much. And I love the part about the language line. So language doesn't have to be a barrier for people. That's super important. Super important. Next up, we have Vernalisa. Tell me about, what is a crisis? When do people call you?
So people should call if they feel that their child is in a crisis situation that is too difficult for them to handle. The people calling know the child they are calling about best, and if they feel the child is off, that is reason enough to call us. Most calls are responded to in less than 30 minutes. However, because we cover such a large area, as Jen mentioned, it can take clinicians up to 45 minutes to respond to a call. If families or folks can't wait that long, they should absolutely call 911. In the meantime, we are still on our way, but they should call because 911 can respond a lot quicker than we can. People often ask when they should call 911 as opposed to 211. Basically, they should call 911 if the child, the caller, or someone else in the presence of the child is in immediate danger. Emergency responders have the ability to arrive for assistance much quicker, as I mentioned earlier, than we can. We also work in tandem with police, and it is at times appropriate for both mobile crisis and the police to respond to a call. Once the scene has been determined safe by the police officers, mobile crisis staff will take control of the scene and conduct the assessment. Some examples of reasons people might contact us are threats of harm to self or others, a youth is in distress, inability to or unwillingness to communicate, a youth is displaying depressive or anxious symptoms, trauma symptoms, or if they simply can't reach their service provider.
So important. I know that question must come up a lot. Like, when do I call 211?
Absolutely.
When do I call 911? Thank you so much for filling us in on that. So back to you, Jen. How are you contacted? How do you get your services?
So, as Lauren mentioned, anyone can call 211 on behalf of a child in crisis. So a person will call 211, press 1 to indicate a crisis, and then press 1 again to indicate that it's a youth in crisis. So I like to say you call 211 and then 2 more ones, and that's how it connects you to us. If anyone had an issue reaching us through that number, there is an alternate number. That number is 1-800-203-1234. And again, you would press 1 and press 1 again. Those calls go to the same place. It's the same service. It's just two ways of reaching us. What happens when you call that number is that a call specialist will answer it based out of our United Way 211 call center in Rocky Hill. They'll gather some brief demographic information like the child's name and the birthday address and some information about what's going on. What is the crisis? The call specialist will then direct the call to the appropriate team. So I mentioned before that we're statewide. So the caller doesn't need to know which team covers their area. The call specialist, when the call comes in, will handle that. The call specialist will contact the appropriate team, give them the information they've gathered, and then connect the caller to the mobile crisis clinician to gather any more information we may need, information about parking, and so they can get an idea of who is going to be responding to their child. From there, the clinician will respond immediately, whether that is doing a telephone response, whether that is setting up a telehealth visit, or if they're getting in their car and heading on their way to meet that kiddo in crisis with their family. As Vernalisa mentioned, because our coverage area is so large, it may take up to 45 minutes for them to arrive. But I want to stress that as soon as the clinician is off the phone getting the information, they are in their car and on the way to the family.
Wow, that's so impressive. What a great service. I mean, it's so wonderful to know that, this is available to people, and there's not a lot of barriers, which is awesome. One more question before we take a quick break. This one is for Lauren. As we talk about barriers, what is the cost associated with this service?
Oh, so there is no out-of-pocket cost to our families. We do bill insurance if we obtain the information, but in the event that there is no coverage, a copay or a deductible would apply, our grant will cover all costs associated with our response.
Wow, that's amazing. It seems like a really streamlined process with not a lot of barriers, and we love that from a public health perspective. So thank you guys so much. We're going to take a quick break, and we hope our viewers will join us right back here on Healthwatch.
I don't remember how it started.
Go to that.
Our back and forth. It always came back.
Dad!
You probably don't remember what you told me,
That was perfect.
but I heard every word.
If doctors, nurses, and grocery store clerks can wear a mask for 10 or 12-hour shifts, you can wear a mask for an hour or less when you go to the store. Do your part. Mask up, America.
Welcome back to Healthwatch. I am here today with 3 guests from the Mobile Crisis Intervention Service. I'm here with Jen, Vernalisa, and Lauren. Thank you guys for being here today. Now, before the break, you guys gave a great introduction about the service. I learned so much, and I know our viewers did too. So as we move in on our discussion, I want to start with response options. Vernalisa, tell me about what the different response options are.
So we have 3 different response types. The first one is called we have mobile responses, deferred responses, and telehealth consultation. So a mobile response is when a clinician and a case manager arrive to the site within 45 minutes. So that's whether they're going to a school, a home, a Walmart parking lot, they will get there within the 45 minutes. The second type, the deferred responses, are when an appointment is scheduled for an assessment to be completed at a later date. So folks will call in and they may say, come out in 2 days, come out in 1 day. They can schedule those out 3 days in advance. The third type is a telephone consultation. The third type is a telehealth consultation, which happens when either the youth or a third party will call in for the phone support that does not include an assessment. So that's when we have a youth who will call in and say, hey, I'm really feeling depressed today. I'm really feeling sad today, and I need someone to speak to. And we will connect them to a clinician who will just speak with them on the phone. There's no assessment. We talk as long as they need to talk, and implement some coping strategies, and try our best to get them through their crises. Due to COVID-19, we also offer telehealth services, which is a new response type for us. During the pandemic, we are offering telehealth options via telephone or electronic device, such as a tablet or a computer, over a platform such as Zoom. When a call comes in, for this type of call, the information is passed to a supervisor to determine if it will be a mobile call or a telehealth call based on everyone's safety. Our goal is for everyone to remain safe.
That's really important. Thank you for letting us know about the different options, especially now. A year ago, I'm not really sure people knew a lot about telehealth. So thank you for letting us know that that's an option. Jen, what happens during a mobile crisis intervention assessment?
So first, the clinician will meet with the caller or the parent or the guardian, whoever that is, to obtain pertinent information about what's going on, gather necessary intake paperwork, there's paperwork with everything, and get an idea of what's going on in that moment. What is the crisis? How can we help? The clinician will then meet with the child themselves to conduct our assessment, which is made up of an assessment of risk of harm to self, risk of harm to others. It's made up of a brief mental status exam. We gather pertinent history, and then again, more information, this time from the child's point of view of what is going on. What is this crisis? Based on the results of the assessment, the clinician will then make a clinical recommendation, such as some sort of therapy or other clinical treatment, and other community resources. And then together with the whole team, the child, the parent or guardian, the caller, if it was somebody else, whoever they deem as part of their village that is help raising their child, we will get together and come up with what our crisis plan. And that crisis plan is there to ensure safety, as well as put in place preventative measures to avoid the family from re-entering this level of crisis. We can also make referrals to clinical treatment and other community resources as necessary, to assist the family going forward with whatever they are struggling with.
Again, that's such a comprehensive service, and I am just blown away. It is such an amazing resource. Moving on to Lauren, what are some ways that parents can help kids in crisis?
So I would say one of the most important things a parent can do is to do their best to remain their child's calm in the storm. This is absolutely easier said than done in many situations, but it's a supportive tactic that can be very helpful in de-escalation. It's also important for parents to check in with their children often, ask questions, no matter how uncomfortable they may be. Open and honest, judgment-free communication is so important. Parents should ask their children, what do you need from me? Additionally, parents can always call us at Mobile Crisis for a non-mobile response, one of the choices that Vernalisa had spoke about, and we can provide support for them over the phone, for them and their child in dealing with the crisis or the situation at hand.
Wow, those are some great tips. I know now more than ever, probably because of the pandemic, we're getting a lot of questions about, anxiety and depression and coping skills. So I'm seeing a lot of that on social media, like people exchanging tips with one another, and people really looking for those resources. So I know everybody's a little on edge, and I know kids are really feeling that a lot. So important that we talk about coping and helping kids and what we can do for them.
Absolutely.
Adults are important too, but
Yep.
kids especially with everything going on in school, and their routines are completely changed. So thank you so much for letting us know about that. Now, Vernalisa, tell us a little bit about the other work that you do in the community.
Well, Mobile Crisis is involved in every aspect of the community. We try to get our hands in everywhere. So our Mobile Crisis team engages in several outreaches throughout the year in partnership with our with other departments at UCFS, the emergency departments, schools, and other community providers. We participate in the Take the First Step suicide prevention walk in Norwich, Connecticut, and we were active in high schools during their suicide prevention week. We respond and offer support to crises and tragedies in the community. We give presentations on a number of topics, including teen suicide, depression, and anxiety, as you mentioned, and we raise awareness to our own services. The Mobile Crisis Supervisory Team are part of various community collaboratives and the Juvenile and Attendance Review Boards.
I know one of the things when I'm not hosting Healthwatch, I'm a prevention coordinator. I run the Groton Alliance for Substance Abuse Prevention, and I know a big part of what I do normally when we don't have a global pandemic happening is I do a lot of outreach, a lot of events, spreading information out in the community, a lot of table events, and certainly I don't get to do a lot of that anymore right now. So it's great to know that you guys are doing other things in the community as well.
Yeah, we certainly try. We like to use the Zoom platform a lot to kind of continue to spread the message.
Absolutely. Let's see, Jen, back to you. I know a lot of parents are probably wondering, if I call Mobile Crisis, are you going to take my kid to the hospital? Will you remove them from my home? What can they expect if they need to call you?
So Mobile Crisis is an inpatient diversion program. So what that means is that our team will try to keep children out of the emergency department if they don't meet criteria for inpatient treatment. We understand that the emergency department itself is very scary and anxiety provoking, and we don't want kids who don't need to be there to be there. Instead, we try to refer and suggest other community resources that can assist the client and their family while the child remains in their home. So we can put in all these other layers of support, including ourselves. We can remain involved for up to 6 weeks to bridge until longer treatment can be provided. However, sometimes due to the level of risk or other mental illness and things going on, sometimes we must refer a family for further evaluation at the emergency department. But if we can avoid it, we will. As anyone working with children, we are mandated reporters, which means we're required by law to report any suspicions of child abuse or neglect to the Department of Children and Families. These laws are in place to prevent children from being abused and to end any abuse or neglect at the earliest possible stage. We don't transport children, so we don't transport them to the emergency department. We don't take them to treatment. We don't take them to a parent's home or to school, anywhere. We also do not restrain children. We remain hands off at all times. We don't have access to residential facilities or remove children from their homes. As you said, this is a concern we often come up against. And again, we try to keep kids at home with their village and putting in what other supports and resources they need to remain that way.
That's really important to know because that can be a very scary time for people. And certainly, as you mentioned, unless it's a children's hospital, emergency rooms are really not friendly places for kids. It can be a scary experience. I once worked at a adolescent group home, and I would occasionally have to go with a child, and it was not a pleasant experience. They would have to see all sorts of unpleasant things, and it just wasn't great. So that's great to know. Thank you. Now back to you, Lauren. Tell us, I mean, we can't talk about anything without talking about the pandemic, right? Because that has really infiltrated everything in health and mental health, of course. What are some trends Mobile Crisis is seeing during the pandemic?
So one significant change for our program during the pandemic, as Vernalisa had mentioned when talking about our response options, is that we do offer telehealth services now, which we have not done in the past. We also can provide over the phone assessments as needed, based on a family's needs and resources. It's definitely a trend in our field at this time to see and hear about a lot of families and children who are struggling with adjustment and isolation surrounding our new virtual ways of attending school and communicating with others. Everyone seems to be affected by these common pandemic stressors in one way or another. We've also noticed in our program a higher frequency of calls that are more severe in nature in terms of the child's level of risk to themselves and others. Additionally, whereas we see typically just over 50% of our calls coming in from schools, that's now been somewhat reversed, with the majority of our calls coming in directly from families.
That's a really good point. I was wondering about that, the percentage of calls that you get from schools. And I know that some of my education sector representatives from GASP, I'll occasionally ask them about their utilization of the service. So that doesn't surprise me that it was about 50% at schools. Now, lastly, with all the information that we've been talking about today, I'm sure our viewers have a lot of questions, even though we covered a lot of ground. Vernalisa, if people were interested in getting more information or wanted to contact you, how should they do that?
Yeah, so if anyone has any additional questions for us, or they are interested in us presenting in their community to learn more about mobile crisis, they can call us by dialing 211, option 1. If they live close to a bordering state, they can reach us by dialing 1-800-203-1234. Either of those options will get them to us.
Thank you so much for letting us know about that. It looks like that's all the time we have today. I just want to say thank you so much, Jennifer, Vernalisa, and Lauren, for all of the great information that you shared with us today. I know I learned a lot, and I'm sure our viewers did too. So that's all the time we have today for Healthwatch. I hope that everybody will join us right back here next time on Healthwatch.
Thank you for having us, Carolyn.
Thank you, Carolyn.